Hello, today I'm going to be doing the NG tube insertion video. I am wearing the school uniform color along with my name badge. So we are going to go into the patient's room. We're going to introduce ourselves. We go into the room, perform hand hygiene, close the door behind us so the patient can have some privacy. Hi, my name is Tanya. I'm going to be your nurse today. Can I please have your name and your birthday? Patient confirms name is Mr. Manny White, and it matches with his ID band. So then we're gonna go ahead and explain the procedure to the patient. So the doctor has gone ahead and ordered an NG tube insertion for you. It seems like you've been having trouble swallowing your food. You kind of seem to be choking. It seems like the food is going to other places like your lungs, so instead of your stomach. So the doctor has ordered for us to go ahead and place the NG tube for you. Do you have any questions before I continue with the procedure? The patient doesn't have any questions. So we're gonna go ahead and put the patient in a high Fowler position. We're gonna check the vital signs. All the vital signs are within normal range. The only thing we are gonna do different is we're gonna keep our pulse oximeter on the patient so that we have those readings as we are doing the NG tube insertion. So I have all my items with me as well. We have a cup with a straw for the patient. I have an emesis bin along with the lubricating jelly. We have a napkin for the patient along with the syringe. We have our gloves, and we have the NG tube here. So first what I'm gonna do is I'm gonna go ahead and check the patient's nostrils, make sure there isn't any obstructions in each nostril. With our pen light, we have the patient hyperextend the neck. All right, Mr. Manny, we're gonna go ahead and check inside each nostril. All right, make sure everything looks good. There's no obstructions. Perfect. There's no obstructions there. We are gonna close one nostril, have the patient blow out. Do the same thing with the opposite side. Have the patient blow out just to make sure which nostril is more potent for the insertion. So go ahead and blow out, sir. Perfect. Go ahead and blow out again. Perfect. Okay, so we're gonna go ahead and do the left nostril just for the video purposes. All right, Mr. Manny, we're gonna go ahead and put our gloves on. We've already performed hand hygiene. Okay, Mr. Manny, we're gonna go ahead and before we give you the napkin, I'm gonna check, I'm gonna measure the NG tube to see how far down we have to go. So we've already brought it out. We're gonna measure from the tip of the nose to the earlobe down to the xiphoid process. So we'll do it this way. All right, sir. So here, tip of the nose to the earlobe to the xiphoid process. So we're looking at about 50. So we're gonna put our tape here as a marker for where we are gonna stop. This is our stopping point once we reach the nostril. Okay, now we're gonna give our patient the napkin. I'm gonna put it right on here. All right, sir. I'm gonna go ahead and open up one of these jellies so that we can lubricate the tip of the tube so it glides in easier. The patient doesn't have such a difficult time. All right, Mr. Manny, so what we're gonna do is we're gonna go ahead and start inserting the tube. If at any point you feel uncomfortable or you need to take a break, I'm just gonna have you raise your hand for me so that we know to take a break. We're gonna go ahead and start the insertion. So I'm gonna have you hyperextend your head. Once you feel the tube going down to the back of your throat with, once your gag reflex starts kicking in, then I'm gonna have you lean your head forward and take sips of water, okay? All right, so patient understands the instructions. All right, sir, so here we go. Ready? 1, 2, 3. I know, I'm sorry. All right, sir, so now he's having that gag reflex, so he's gonna start taking sips of water. He's gonna tilt his head forward, and we're gonna continue to insert as he takes his sips of water. All right, perfect. All right, sir, you're doing okay? All right, we're almost done. We're almost there. All right, good job. So we've gone ahead and ended where the marker is. Patient is doing okay. We're gonna keep this nearby on the patient. All right, and now what we're gonna do is we're actually going to anchor the tube to the patient's nose. All right, so that's anchored there. All right. So while we wait for the x-rays, we're actually going to, well, we have it clamped. While we wait for the x-rays, we're actually going to unclamp the tube, and we are going to check against the pH. Make sure that the stomach, the contents that we got are from the stomach, and that we're gonna check it against our bottle, make sure that the pH is within normal range, which is 3.5 to 5. All right, so we're gonna go ahead and aspirate about 10 cc's. And we're gonna put it, we're gonna clamp. I'm gonna put the aspirates in our tube, in our emesis bin. I'm gonna toss that because we don't need it anymore. Okay. And while we're waiting for x-ray again, we're gonna go ahead and check the pH with the strip. Dip it and hold it against the bottle. Make sure that it's good. 3.5 to 5 is the pH that we want, and it matches on the patient. Perfect. Okay, so now the patient has gone ahead and to his x-rays. The x-rays have confirmed placement is in the correct area. So now what we're gonna do is we're actually gonna go ahead and pin the tube to the patient's gown. All right, so we pin the tube to the patient's gown, and then we're gonna fix we're actually gonna fix the tube here because this was just a temporary one. So we're gonna fixate the NG tube to the nose appropriately. All right, sir. I'm gonna put a different type of tape just so it can be better, so it can hold better for you, okay? And we're still at our mark point right there. Tube hasn't gone in any further. So now we're actually gonna go ahead and hook up the NG tube to the suction. And we're gonna check it every 2 hours just to make sure that the patient is not aspirating or anything like that. Okay, so now we just want to make sure that the head of the bed isn't too low. We have to keep it a little bit elevated so that the patient doesn't aspirate on any contents, any of the food or enteral feedings that he's receiving. We take our trash, okay, take the napkin, throw it away, but we're pretending that this is the gown, so we're gonna leave it on there for now. We throw all this stuff away. Before you leave, you ask the patient if you need anything. Okay, Mr. Manny, everything went well. The tube placement is in the correct place. The head of the bed is elevated. Your call light is within your reach. If you need anything, please go ahead and call us through the call light. But before I step out, is there anything else I can do for you? Okay, so the patient says no. He just wants to rest. He's had a pretty long day, so we remove our gloves, throw it in the trash. We wash our hands before we step out. Step out of the room, close the door behind us so that the patient can have some privacy, and then we're gonna go ahead and document the procedure, the way the patient tolerated the procedure. You're gonna document the contents that were aspirated, the characteristics of the contents. You're gonna describe the color of the contents. You're gonna document the pH that was within the normal range. You're gonna document the vital signs and how the patient is doing after the procedure as well. And that concludes the NG Tube Skills video for me. Thank you.